Hi, my name is Margaret Red. I'm a nurse practitioner student at Maryvale, and this is my physical assessment video. This is my patient Austin. Prior to coming in here, we took his height and weight. He's 5'10" and weighs 165 pounds. So those are all, that'd be a good body weight for his height. We also had him go ahead and get in a gown and took his vital signs. His temperature was 97.8, his pulse was 98, his blood pressure was 128/70, his respiratory rate was 16, and he did not complain of any pain today. I did offer Austin to empty his bladder so he would be comfortable for the exam. We also tested his near and far vision. Both were 20/20 using the appropriate test. So now we're going to go ahead and go into our assessment. So I'm going to start by noting Austin's general appearance, noting that he's well nourished and well hydrated. He's groomed and is dressed appropriate for the weather. Next, we're going to go ahead and start with our head. So I'm going to go ahead and inspect the head, starting by a visual assessment. So I'm assessing that his eyes are in the proper alignment. They're not too close together. His ears are properly placed on his head. His hairline is symmetrical. He doesn't have any lesions, masses, any changes in pigmentation. Next, I'm going to go ahead and have Austin do a couple facial movements. So Austin, can you clench your teeth for me? And go ahead and close your eyes really tight. Wrinkle your forehead. You can open your eyes and wrinkle your forehead. Okay. Go ahead and stick your tongue out and puff your cheeks out. Alright. So I'm noting symmetry when he does all these movements, noting that the face was symmetrical for all those movements, which would be a normal finding. Next, we're going to go ahead and palpate. So I'm going to go ahead and palpate the skull, noting that the scalp moves freely over the skull. There's no lesion. Did that cause any pain? No tenderness. I'm also going to go ahead and palpate the TMJ joint. So go ahead and open up for me and close. And I'm noting for any crackling, any crepitus, any popping. Did that cause any pain? And there was no tenderness on the TMJ palpation. Next, I'm going to go ahead and palpate the facial bones, noting for any tenderness or abnormalities there. Is that tender at all? So there's no tenderness, no lesions, no masses, no swelling. Now I'm going to go ahead and palpate the frontal sinuses as well as the maxillary sinuses. Does that cause any pain?
No.
So there's no tenderness in the sinuses. Next, go ahead and close your eyes for me and tell me if you can feel this bilaterally.
Yes.
Alright, so light sensation is intact bilaterally. So we'll go ahead and move on to the eye assessment. I'm going to go ahead and start by inspecting the external structures, noting that his eyebrows are symmetrical. The hair growth passes the outer canthus. His eyelashes are symmetrical. They curve outward away from the globe. I don't know any redness or swelling around the eyes, and there is no obvious discharge. So now I'm going to go ahead and palpate here. Does that cause any pain?
No.
So there's no tenderness or edema to the eyes. I'm also going to go ahead and palpate the lacrimal apparatus. Is there any pain there? No. And next we'll go ahead and look at the eye a little better. So go ahead and open those eyes wide for me, noting that the sclera is nice and white. It is free of erythema or discharge. And then I'm going to go ahead and grab my light here. Alright, and go ahead. And the conjunctiva are nice and clear and free of any erythema or discharge. We already tested his near and far vision before we came in, so I'm going to go ahead and test pupillary response, noting that I'm going to do both. Go ahead and just take a look at my nose here. And I'm testing direct and consensual, so direct and consensual. I want you to just follow my finger here. Alright, so pupils are equal and reactive. They're 3 millimeters. They are reactive to light and accommodation. And then next I'm going to go ahead and test your cardinal fields of gaze. So let me grab. Alright, go ahead and I want you to follow my pin to all the areas that I go to. Not moving your head. Alright, so I'm noting that the extraocular movements are all intact and there was no nystagmus when he looked to those gazes. Now, I'm going to go ahead and have you cover your eye for me and look at me. And now cover the other eye. Right. So in the cover-uncover test, I'm noting that there was no nystagmus or no extra movement. Next, we're going to go ahead and move on to the ear assessment. So I'm going to start by inspection, noting that there's no swelling, no redness, no deformity lesions, no masses, no abnormalities there. We'll go ahead and palpate the auricles and around the mastoid. Does that cause any pain?
No.
All right, so there's no pain, tenderness. They're symmetrical. There's no swelling, no warmth, no lesions, no masses that I didn't see on inspection. So we're going to go ahead and we'll perform the whisper test to test Austin's hearing. So I'm going to go ahead and I'll have you kind of face that way for me. All right, and repeat the word I say.
Apple.
All right, and then we're going to do the same on the other.
Orange.
All right, so Austin was able to hear that whisper. Next, we'll go ahead and test air conduction versus bone conduction. So I'm going to place this on your mastoid, and then I want you to tell me when you can't hear it anymore, and then I want you to, then I'll place it next to your ear, and then again tell me when you can't hear it anymore. You can still hear that?
Okay.
So we're looking to see that air conduction is twice as long as bone conduction, and that would be a normal finding. So next we're going to go ahead and look inside Austin's ears using the otoscope. So I'm noting that the canal is nice and pink. It's free of any redness, swelling, discharge, foreign body, or excess wax. The tympanic membrane is nice and pearly gray. Landmarks are easily seen. The cone of light was seen. There's no perforation, no redness, and no bulging. And I would look at the other ear and make sure that those findings are symmetrical as well. So next we're going to go ahead and move to the nose. I'm going to start by inspection again, noting any lesions, swelling, foreign bodies in the nair that I could see obviously, but we'll look in later. Also I'm looking for swelling or any obvious deformity, which Austin does not have. We'll go ahead and palpate. Is that causing any pain?
No.
Noting that there's no tenderness, there's no lesions, no masses, no edema. We'll go ahead and note that go ahead and look up a little bit for me. The septum is nice and midline, there's no deviation. And we'll go ahead and take a look up in there. Alright. Noting that there's no foreign body, the turbinates are visible, there's no perforation, no edema, no discharge. And then lastly, I'm going to go ahead and have you, we're going to test for patency. So if you'll go ahead and cover one nose for me and breathe. Alright, and now the other. Alright, so Austin's nose is patent bilaterally. Next, we'll go ahead and move on to the mouth. So again, we're going to start with inspection, looking at the lips, noting that they are nice and pink and moist. There's no cracks, there's no lesions, there's no abnormalities, there's no excess dryness. Go ahead and open your mouth for me. Alright, we're going to start by looking at the teeth, noting that there are no dental caries, no cracks, no obvious abnormalities there. Noting that the tongue is nice and pink. There is no, go ahead and put it side to side for me. Alright, other side. And there's no lesions, there's no swelling. There's no exudate, there's no like film on the tongue. I'm gonna go ahead and note the buccal mucosa and the hard and soft palate, noting that those are nice and pink and they're without any redness, swelling, lesions, anything like that. Go ahead and lift your tongue up and go ahead and see the top of your mouth again. And I'm noting that there are no signs of Ludwig's infection, and there's also no signs of a tonsillar abscess. Now we'll go ahead and look at the posterior oropharynx. So go ahead and open up again for me. Say ah. All right. I'm noting that the uvula is midline. It does rise symmetrically. There is no exudate, no redness, no swelling. There's no lesions. The tonsillar pillars are visible, and the tonsils sit within the pillars, and they are 2+. Go ahead and say ah again for me. All right, and his gag reflex is intact. So now we're going to go ahead and move on to the neck. We're going to start by inspection. I'm noting that Austin's neck looks smooth. There's no JVD upon inspection. There's no lesions. The skin pigmentation is normal. It appears that the trachea is midline, and there is hair distribution is equal within the neck. So we'll go ahead and go on to palpate. I'm going to palpate the carotid pulses one at a time, noting the rate and density in the rhythm. So the carotids are 2+, and the rate is regular. I'm also going to palpate the trachea, noting that the cartilage rings are palpable. It is midline. And then I'm going to move and palpate the thyroid. Go ahead and swallow for me. All right. So the thyroid does slide nicely and smoothly through my fingers. There's no nodules. There's no enlarged thyroid based on palpation. I'm also going to test Austin's range of motion of the neck. So I'm going to go ahead and have you touch your chin to your chest, all right, and back. Then your ear to your shoulder. Then your other ear to your shoulder, all right, and then turn left and right. So, and then shrug your shoulders for me. All right, so passive range of motion is intact. Go ahead, I'm going to apply a little pressure. So, other way, forward, back, and shrug your shoulders. All right, so those muscles are nice and strong. He has a good force against my force, so active range of motion is intact as well. And lastly, we're going to go ahead and listen to the carotids to make sure there's no bruits. A bruit would indicate some turbulent blood flow and would be a concerning finding. But Austin's carotids are free of bruits. I am going to go ahead and assess the lymph system while we're here. So I'm going to go ahead and start by palpating the lymph nodes. We're going to start with cervical, pre-auricular, post-auricular, tonsillar, submandibular, submental, your inferior cervical, inferior superficial cervical, posterior cervical, deep cervical, supraclavicular, infraclavicular. We'll go ahead and assess the axillary nodes. Noting that none of those nodes are more than 1 centimeter. They are not shoddy, matted. There's no tenderness that didn't cause any pain.
Yeah.
And none were enlarged. No concerning findings for me. So we'll go ahead and move on to the upper extremities. We're going to start by inspecting the hands, noting that the nail beds are free of cyanosis. There's no clubbing. I'm going to note that the fingernails are nicely groomed. The hands pigmentation is normal to his skin pigmentation. His arms, I'm going to go ahead and assess that hair distribution is normal. There is no he does have pigmentation variations. All are not concerning findings. They're all small, freckle and mole-like, color symmetrical. Their borders are nicely well defined, and they're colors consistency and nice and round. I'm going to go ahead and keep assessing, looking at the arms and the shoulders, noting the same pigmentation variations that would not be concerning. There is good muscle tone. There's no atrophy. Hair distribution is equal. We'll go ahead and move on to palpation. I am going to test cap refill, noting that the cap refill is brisk. I'm going to go ahead and, does this cause any pain for you? No. Alright, so noting that there's no pain, there's no tenderness, the muscles are well defined. I'm going to go ahead and palpate the radial pulse, noting its rate, rhythm, and density, noting that the radial pulse is 2+, and it is regular and brachial. Noting that the brachial pulse is also 2+, the rate is regular, and the bilaterally, which would be normal findings. So next we're going to go ahead and move to the back. So Austin, if you wouldn't mind, I'm going to have you just kind of tilt your body this way for me. I'm going to undo this gown so we can really get a good assessment of your back. So I'm going to note the thoracic configuration, noting that the AP diameter is 2:1 to the lateral diameter. I'm also just kind of noting general pigmentation is normal to his skin tone. I'm noting that there's no deformity, no bruising. I'm going to go ahead and palpate here. Please tell me if I'm causing any pain while I palpate along your spine. No pain there. Alright, so I'm going to palpate again here, noting any pain or tenderness. Any pain in the CVA area. I'm going to go ahead and elicit percussion here. Any pain elicited there. Alright, so it's free of CVA tenderness. The spine is nice and midline. There's no point tenderness, no curvature that are abnormal, and no tenderness, no step-offs were noted either. Next, we'll go ahead and move into our respiratory assessment. So I'm kind of assessing his respiratory rate. There's no intercostal movements, no increased work of breathing. Noting that posteriorly it looks as if his work of breathing is within normal limits. Next, we'll go ahead and we'll do thoracic expansion. So I'm going to put my hands at the level of T10. Take a big deep breath for me. And alright. So my hands move symmetrically, noting that thoracic expansion is symmetrical bilaterally. We'll next move on to tactile fremitus. So I'm going to go ahead and percuss. So if you will, take a big deep breath and let it out. I'm sorry, this would actually be diaphragmatic excursion, not tactile fremitus. So we'll go ahead and start with the tactile fremitus. So go ahead and say 99 as I'm moving my hands.
99, 99, 99, 99, 99.
Alright, noting that there is no excessive pulsations, I'm just noting that there is no increase or decrease for fremitus as I move my hands, which is a normal finding. Now we're going to percuss the chest, and I'm going to percuss in a very systematic fashion, noting the resonance, and noting that there is no dullness. So resonance would be a normal finding, dullness would be an abnormal finding. Now we're going to move on to the diaphragmatic expansion by percussing that. So if you'll take a big deep breath and let it out. Right, I'm going to percuss down, noting when I hear a change. Alright, and I'm going to mark that there. Now let it out. Take a big deep breath and let it out. And then I'm going to percuss up from there. Noting the difference is about 4 centimeters, which would be a normal finding. I would also do that on the right side, noting that that might be a little higher just because that's where the liver is. So next, I'm going to go ahead and auscultate. So I'm going to do this in a systematic fashion. Take a big deep breath every time I move my stethoscope, please. Alright, Noting that his lung sounds are clear, they're free of wheezes, free of adventitious brush sounds, no stridor, no rhonchi, nothing like that. I'm also going to go ahead and listen to the lateral chest. I'm also going to do that in a systematic fashion. I would do this bilaterally, noting that there is free of any adventitious breath sounds, free of wheezes, lung sounds are nice and clear. So next we'll go ahead and move on to the anterior chest. So I'm going to go ahead and I'll have you kind of just slip your gown off in the front so I can really assess that. So I'm again starting by inspection, noting the respiratory rate, noting that his respiratory effort is within normal limits, noting there's no accessory muscle use, noting there's no retraction, noting the hair distribution is even, and then I'm going to go ahead and note that there is I don't see any pulsations or heaves. I'm going to go ahead and palpate, so I'm going to start by palpating the chest wall here. Is that causing any tenderness? Noting that there's no crepitus, there's no subcu air, and it's nice and symmetrical without lesions, without swelling. It's nice and warm symmetrically. Next we're going to go ahead and we'll percuss the precordium. Palpate, I'm noting that there are no heaves or pulsations, there's no tenderness upon that palpation. We'll go ahead and palpate the apical impulse. We're going to start by going mid-clavicular line, 5th intercostal space, and I'm going to feel here. Okay. And I can palpate that apical impulse without difficulty. So next, we will go ahead and do tactile fermentas on the anterior chest. Say 99.
99. 99. 99. 99.
All right. Noting that the vibrations are even, there's no increase or decrease in tactile fermentas. We will go ahead and auscultate now. So I'm going to do this in a systematic fashion as well. First, I'm going to listen for breath sounds. Take a big drink of breath every time I miss it, so please. And now I'm going to listen to heart tones. So we're going to start aortic, pulmonic, Erb's point, tricuspid, and mitral. So I noted that the respiratory, there were no adventitious breath sounds. The lungs were nice and clear. There was no rhonchi, no wheezes. The heart tones were regular and easily audible. S1 and S2 were heard. I did not hear S3 or S4. There was no murmur, no clicks, rubs, or gallops. Next, we're going to go ahead and move on to our abdominal assessment. So I will have you lay down now. And I'm going to go ahead and we'll lift up your gown. So we're going to start with inspection. I'm going to inspect the abdomen, noting no pulsation. There's no obvious distension. The stomach's nice and flat. It's symmetrical. It's free of lesions, bulges, bruises, or skin abnormalities. So I'm going to go ahead and auscultate bowel sounds now, doing this in a systematic fashion in all 4 quadrants. Noting that bowel sounds are easily audible in all 4 quadrants. Next, we're going to go ahead and auscultate the arteries. So I'm going to start with the aorta, the renal, the iliac, and the femoral. Noting that there are no bruits, there are no abnormalities found there. Next, we're going to go ahead and we will percuss the abdomen. So I'm going to start by percussing the liver border, noting that we're going to start at the right costal margin and palpate dullness to resonance, marking the changes. I'm going to measure that, and that is 9 centimeters, which is normal. 6 to 12 is a normal finding. Can you go ahead and roll towards me? And I'm going to percuss the spleen for dullness. Right, and that was dullness, so that would be a normal finding. You can go ahead and go back on your back. I'm also going to just percuss that over the abdomen in general, noting that the the solid organs are dull, where your air fluid-filled organs are tympany is hurt. So now we'll go ahead and we will palpate. I'm going to start with light palpation, noting any tenderness, noting that it's symmetrical. Does that cause any pain? All right, noting that there's no masses, no no tenderness, and there's nothing felt that that is abnormal or would be concerning. And now we'll go ahead and go to deep palpation. Again, like eliciting to see if that causes any tenderness. Does that cause you any pain? All right, noting that there's no pain there. So now we're going to go ahead and palpate the liver. So I'm going to start here, 1 centimeter down. That's causing some deep palpation. And I am able to palpate the liver borders. There's no enlarged liver. The borders are nice and smooth, no lesions, nothing that's concerning here. And then I'm going to also palpate the left in the same area, noting that I cannot feel the spleen, but that's not necessarily, that would be a normal finding. So we'll go ahead and do deep palpation. We're going to palpate those kidneys. So take a big deep breath and hold it. And again. And then noting that there's no increased size in the kidneys or lesions. And then go ahead and do one more so I can palpate here. Alright, noting that there is no pulsation over the aorta. Go ahead and just like lift your neck up like you're doing a sit-up. Alright, noting that those ab muscles are nice and tight and they're well defined, which would be a normal finding. So you can go ahead and sit back up. We're going to go ahead and move on to our leg lower extremity assessment. So I want you to go ahead and I'm just going to lift these up. I'm going to start by inspection, noting that hair distribution is equal. There's no swelling, no obvious deformity. I'm going to go ahead and palpate, noting the temperature, noting there's no edema, am I causing any pain? And no tenderness. Alright, go ahead and lift your feet up and down. Alright, and I'm going to palpate the pedal pulse, posterior tibial pulse, the popliteal pulse, noting that there are no abnormalities there. They're symmetrical bilateral. Pulses are 2+, and the rate is regular. We're going to go ahead and move on to our neuro assessment, which we've already assessed most of the cranial nerves. Cranial nerve 1 would be assessed by smell. That's not assessed very often, but we could bring in a smell, have him close his eyes, smell, and see if he was able to identify those smells. Cranial nerve 2, we did assess when we did the Snellen chart outside the room, and his vision was 20/20, so cranial nerve 2 is intact. Cranial nerve 3, 4, and 6, we tested with the extraocular movements when we tested the cardinal fields of gaze. So cranial nerve 5, we assessed when we did TMJ and facial sensation, which was normal. Cranial nerve 7, we assessed when Austin made the different facial movements, puffing out his cheeks, clenching his teeth, wrinkling his forehead. Cranial nerve 8, we assessed with the auditory exam, so we did that by the whisper test as well as the tuning fork. And then 9 and 10, we tested when we saw the rays of the uvula and the gag reflex. Cranial nerve 11, we assessed when Austin did the shoulder shrug and was able to do that against resistance. And we assessed cranial cranial nerve 12 with the tongue symmetry. Austin stuck his tongue out, moved it from left to right, noting that cranial nerve 12 was intact. So lastly, we're going to test light sensation and the dermatones. So Austin, I'm going to have you close your eyes, and I just want you to tell me if you can feel where I'm touching you and if it feels the same symmetrically.
Mm-hmm. Yes.
Still the same?
Yes.
You can feel me touching you
Yes.
in all areas?
Yes.
Alright, and then we're going to go ahead and test those reflexes. So we're going to start with the brachial reflex. Just relax that hand for me. Give me all the weight. Perfect. Now we're going to do the patellar. And the Achilles. Alright, so his reflexes are all intact bilaterally. So lastly, we're going to kind of move on and test your cervical spine strength. Go ahead and tilt your head back and forward. And go ahead and do that against me. Alright, and now we're going to just kind of assess muscle strength in general. Go ahead and squeeze my fingers here. Push me away. Pull you toward. Oh, perfect. Alright, so I want you to go ahead and put your fingers out like this. Don't let me move them. Alright, and put your fingers like this for me, and don't let me pull them apart. Alright, and then go ahead and push against my, now the other way. Alright, and here, and other way. Okay, and then push down on my hands and pull up. Alright, so his muscles, he's able to move them all. Range of motion is normal. He's very strong, able to push and pull against my weight. So those are all good things. Lastly, we're going to test the lumbar spine. So if Austin, you would care to stand up for me. And we're going to just kind of look at the range of motion of his back. Go ahead and bend over and touch your toes. And then stand up. And then arch your back for me. Alright, does that cause any pain?
Mm.
No. Alright, so his range of motion is good. That lumbar spine seems to be really nice and strong. So that kind of concludes our examination, our assessment. So I'm going to thank Austin for taking the time to let me do a physical assessment. And do you have any questions for me?
Mm.
Alright, thank you.